Thank you, Amalia, and thank you all for joining WFSA's virtual summit. As the Director of Research and Advocacy, I'm honored to share our findings, including what we focused on this past year and what we have in store for 2023. WFSA's research drives everything we do, from our public policy work to our grant making and innovative strategies. Every facet of our work is rooted in nonpartisan research and is validated by a committee of women who have lived the experiences. Through research, WFSA identifies the biggest economic barriers and opportunities for women and girls in Arizona. We take that research and create bold, innovative solutions that generate change. We recognize that knowledge, data, and awareness are vital in understanding the barriers preventing access to systems of care, so we collaborate with numerous research partners to conduct studies that guide our work for gender equity. We know that thorough, accurate, and intentional research takes time, and we value our research and community partners for conducting and supporting these efforts. During this year, WFSA engaged in two major research projects. First, in partnership with the University of Washington, we updated the self-sufficiency standard for the state of Arizona. We'll be talking with our research partners from the University of Washington in just a bit. Secondly, we conducted research using an online tool created by the Federal Reserve Bank of Atlanta, which predicts which Arizonans enrolled in public benefits will encounter the benefits cliff. So what is the benefits cliff exactly? Well, the benefits cliff occurs when individuals lose public benefits, usually suddenly, when they exceed the income eligibility limit. Individuals can experience the benefits cliff when they accept work promotions with a pay increase or get a job with higher pay, even if it's still not enough to make ends meet. The Benefits Cliff Dashboard was created by the Federal Reserve Bank of Atlanta Advancing Careers Initiative, or Atlanta Fed, who partnered with WFSA to tailor the tool, making it specific to the state of Arizona. This interactive tool depicts wages along select career pathways and pinpoints where individuals will experience loss of benefits as their income increases. The idea of losing benefits can be enough for individuals to refuse career advancement because the added income is not enough to cover the loss of the benefit. As a result, individuals may decline career advancement and wage increases to stay below the benefit eligibility threshold. For families, either decision can be devastating. This creates a significant barrier to economic mobility and self-sufficiency. This summer, WFSA partnered with 5 organizations and 113 participants to pilot the Benefits Cliff Dashboard over a 12-week period. In addition to calculating changes in benefits, these organizations provided case management, offered financial and career planning, and provided wraparound services to offset the cliff effect. They helped individuals choose career paths, create timelines for education and training, and use the tool to predict when clients would experience a benefits cliff as their wage increased. Over the 10-week study period, our 5 pilot partners examined the use, strengths, and limitations of the Benefits Cliff Dashboard to move individuals towards self-sufficiency. Our partners included Dress for Success Phoenix, JobPath, Sahuarita Food Bank and Community Resource Center in partnership with the Pima County Community and Workforce Development, Our Family Services, and Unlimited Potential Phoenix. The pilot research study also assessed the overall feasibility and usability of the Benefits Cliff Dashboard tool, the efficacy of the dashboard in helping clients understand when they would experience a benefits cliff and how to prepare for the loss of that benefit, and the social and economic supports needed to offset the impact caused by the benefits cliff. WFSA and the Federal Reserve Bank of Atlanta Advancing Careers Initiative are committed to the research, seeking to improve the economic mobility and resilience by identifying how the benefits cliff and other structural barriers create financial disincentives to career advancement, conducting research, developing tools, and analyzing solutions on mechanisms for reducing barriers to economic mobility, and engaging in partnerships to support community and state efforts to improve economic security for families. We are grateful to the Federal Reserve Bank of Atlanta and our partners for being part of this eye-opening research study, and we look forward to releasing a comprehensive report in the new year. Partnerships like these are instrumental in moving the needle for economic mobility for women and girls in Arizona. The core of WFSA's research is our self-sufficiency standard. The self-sufficiency standard was introduced in 2018, informing Arizonans what the true cost to live an economically stable life in our state. We partnered with the University of Washington's Center for Women's Welfare to create the tool that is now in use with partners throughout Arizona. Joining us today are Annie Kucklick, researcher, and Lisa Manzer, director, from the University of Washington School of Social Work, Center for Women's Welfare, to discuss the updated 2022 self-sufficiency standard for Arizona. Throughout the year, Annie and Lisa have been updating the self-sufficiency standard for Arizona, including an interactive online tableau and full research report, which we are officially releasing today. Welcome, Annie and Lisa. Thank you for being with us for another awesome WFSA event.
Thank you for having us. Excited
Happy to be here. Thank you.
As you know, we are publicly releasing the updated self-sufficiency standard report today after our summit event. So how about we just jump right into some Q&A? How does that sound? So your team has been working on updating the self-sufficiency standard for the state of Arizona throughout the year. Can you give us a quick snapshot of what the self-sufficiency standard is?
I'll take that one. Yes. I think, the way I think about it is that we all generally know what we mean when we're talking about poverty. We think about individuals and households that don't have enough to meet their basic needs, households that are worrying about falling behind on rent or having their utilities being shut off, parents that go hungry so there's enough for their children, workers struggling to stay employed when their transportation is unreliable. But what we mean when we talk about poverty and what we mean when we actually measure are two very different things. That's where the self-sufficiency standard comes in. We try to address this disconnect between what we mean and what we measure by taking a more realistic approach than the official poverty measure calculated by the federal government. The standard was developed in the early 1990s by Dr. Diana Pierce. She was asked to design a performance measure for the goal of self-sufficiency in federal job training programs. Women were leaving these programs, typically as typists. Their incomes were above the poverty line, but they were still really experiencing hardships. So she was tasked with creating a measure that was realistic and detailed on what working families really needed to be self-sufficient, to define a measure of income adequacy, not income inadequacy. So to do this, the standard takes a market basket approach of measuring the cost of each basic need individually. While the poverty measure just includes the cost of food, all major budget items faced by working adults are included in the self-sufficiency standard. This is housing, childcare, healthcare, transportation, taxes and tax credits, and miscellaneous costs such as clothing and broadband. While the poverty measure is the same throughout the continental US, the standard accounts for geographical differences in costs. It varies in costs by age groups of children. So we're talking about infants, preschoolers, school age, teenagers, all having different costs. This is especially important for childcare. which varies substantially by age. Overall, the standard defines a realistic measurement of the income requirements for 719 different family types across each county in a given state. I do want to make an important note that the standard is calculated to be minimally adequate. The goal is to calculate the income that would be needed to just meet basic needs without public benefits such as SNAP or informal assistance such as childcare, help from a relative. And for that reason, it is a very bare bones basic needs budget. The default wages don't really have an added cushion to support long-term economic security, to survive a job loss or a broken down car without the potential risk of hardships.
Yeah, thank you for that great explanation. We've had the self-sufficiency tableau on the WFSA's website since our luncheon event in April. Can you tell us what updates have been made to this tableau?
Yeah, I'm happy to tell you about that. So the Tableau dashboard, as you know, that we had designed in partnership with you all at the Women's Foundation, visualizes the self-sufficiency standard. And it really allows for a user to get a more personal understanding of the data by navigating through their own county, through their own family type. It can be used by advocates who are looking to present a visualization of the self-sufficiency standard to their legislator. It's really meant to be a tool that is usable for people who are visiting the site. The difference that we made on this update is that the Tableau tool now has 2022 childcare data included in the calculation of the updated self-sufficiency standard. This is also the updated self-sufficiency standard that's being used to inform the report that is now released. Due to data collection lags as a result of the pandemic, the Arizona childcare market rate survey, which informs the childcare costs in the self-sufficiency standard, was not actually released to the public until July 1st of this year. So the new Tableau updated version has the updated 2022 childcare costs included. Now, childcare costs are important, and we really wanted to ensure that this data was up to date because childcare costs often take up the most significant portion of a family's budget, particularly if that family has young children. As an example, between the last childcare market rate survey in 2018 and now, childcare costs have risen by 24% for infants, 17% for preschoolers, and 50% for school-age children who attend childcare full-time during the summer and part-time before and after school. That's what is accounted for in the self-sufficiency standard during the school year. This is substantially more than even the inflation measures show, which only show an increase of 14% since 2018 for the childcare and nursery school CPI index. So it was very important to us to get that data up to date, and that is now reflected in the Tableau dashboard.
I appreciate that update. I know in addition to being incredibly helpful in understanding the self-sufficiency standard for Arizona, I've also received several comments about how visually engaging the Tableau is. So just thank you so much for creating this tool for WFSA. So how are other states or organizations using the self-sufficiency standard for their state?
That's a good question. And a lot of different ways. Really, the standard was initially developed as a performance benchmark for measuring the quality of jobs. Now it's used in all sorts of different ways. Many of our partners go beyond the question of just asking how much is enough, but they also want to know how many households are not making self-sufficiency standard wages. To do that, researchers at the center, we utilize American Community Survey microdata sets to understand who's overlooked and undercounted. That is, who's above the poverty threshold and potentially not eligible for benefits, but their household incomes are still below the self-sufficiency standard. So they're at risk of facing some real daily financial struggles. So that is one of the big ways that the standard gets used throughout the country. Also, as programs are moving away from poverty guidelines for setting income eligibility, more organizations turn to the standard. The state of Wisconsin uses the standard to determine income eligibility for federally funded workforce training. State of Colorado uses the standard for setting the income eligibility levels for childcare assistance. Portland, Oregon uses the standard for prioritizing slots in their free preschool program. Advocates and policymakers, they look to the standard for highlighting need as well as assessing the impact of policies. We've been working with the state of Connecticut to use the standard to model the impact of new and proposed health policy levers on residents, such as the premium tax credit changes that were extended in the Inflation Reduction Act, and policy changes such as their expansion of the state EITC. The standard's an important tool for determining the minimum families need to get by in a community. IKEA, for example, uses the single adult standard as an input into their wage algorithm for varying starting wages across the US stores. And then thanks to the advocacy efforts of our partners in New York, the city just passed a ballot measure that requires the city government to calculate a true cost of living. Overall, across the country, the standard is used to negotiate wage contracts and to advocate for higher minimum wages. In Oregon, for example, the legislature used the standard to set the current 3-tiered minimum wage that's in place in Oregon now.
Wow, that's fantastic. It sounds like so many of our, so many states are using the standard. And I just wanted to mention that all 50 states have engaged in the self-sufficiency standard work at some point. So I just really think that's a testament that many are realizing that the self-sufficiency standard should be the standard when determining wage income adequacy for self-sufficiency. So that's great. Thanks for giving us an overview. So I know, and many of our viewers know, that creating a robust but very clear to read report is probably not always easy. And so I just want to say thank you and kudos, because that's exactly what you all have done with this report. And I'm so excited for people to dig right into it. And so the next question is a two-parter. Can you highlight some key findings from the report? And also, a question that we receive a lot is, what about inflation? Could you give us an idea of how and if inflation is factored into the self-sufficiency standard report and also the tableau?
Yes, great questions. I'm happy to take that on. I'll start with the key findings for that. So we're really excited to release this report. Highly recommend going to the website to dive in and see some of the findings there yourself. But I'll go over a few of the key findings that we present in the report. So in Arizona, the amount needed to be economically self-sufficient really varies by geographic location. For instance, the amount needed to make ends meet for one adult and one preschooler varies from $20.01 per hour in Santa Cruz County, all the way up to $27.89 per hour in Coconino County, or from about 231% of the federal poverty guidelines to about 322% of the federal poverty guidelines for a family of two. For families with young children, the combined costs of housing and childcare typically make up the most substantial portion of a family's budget. We find this to be true across the United States, and it's also true in Arizona. For example, a family with 2 adults, 1 infant, and 1 preschooler living in Pima County, childcare costs 29% of that family's budget, while housing is 16%. The amount needed to meet basic costs of needs has increased significantly over the last 20 years, which is also featured in the report. It's increased in all Arizona counties. For a family of 2 adults, 1 preschooler, and 1 school-age child, the standard increased by 83% on average across the state. Additionally, Arizona has experienced some dramatic housing cost increases even in the last year. So from 2021 to 2022, the price of a one-bedroom apartment increased 14% in Greenlee County, 12% in La Paz County, and 10% in Coconino County. The report also compares the standard to other earnings benchmarks. For example, for a parent who has a preschooler and a school-age child living in Yavapai County, this parent would be able to cover just 53% of that family's basic needs while earning a minimum wage job. This is after their take-home pay and accounting for taxes. Additionally, only 2 of the top 10 most common occupations in the Tucson metropolitan statistical area have median wages above the standard for a 3-person family in Pima County. Only registered nurses and operations managers have median wages above the self-sufficiency standard for a single adult with a preschooler and school-age child, which is about $29.89 per hour. To get to the second question, the report and the data does factor in inflation. We use the most up-to-date information and data sources. However, if a data source, such as out-of-pocket medical expenses that's used in our healthcare calculation, is not currently up to date, then we will use the CPI inflation index specific to that cost to inflate it to the current month of data production. It's important to acknowledge that recently the country has experienced exceptionally high rates of inflation, really sharpening the financial strain for families who have already been dealing with costs rising and median earnings, particularly for low-wage jobs, staying relatively consistent. Previous standard research indicates that the cost of basic needs rise faster than general inflation measures reveal. This means that for low-income families, they deal with even more burdensome increases than indicated by the all items CPI data, which is the statistic that you typically hear. It shows an 8.3 increase for the CPI West region in September of this year. You know, as an example, the CPI for energy costs alone is 20.1% in that same region for the same time of September of this year. So low-income families in Arizona have been dealing with the cost of living rising faster than wages even before this period of high inflation, and these rapid cost increases now just really further aggravate the real but hidden economic crunch that these families are experiencing. Thank you for that question.
Yeah. I think we've all been, to the grocery store and have seen the increased costs just on food alone, not to mention all the other factors that are put into the self-sufficiency standards. So thank you for that. So my last question is, your team has focused on the self-sufficiency standard over the years, and you've released many reports throughout the country. Is there anything that makes this report unique for WFSA?
Yes, definitely. Happy to answer that. So every report has unique findings because we look at county-specific data for different family types. But I think what sets this report apart in particular is the input and feedback that you all got from the Women's Foundation Family Advisory Council. So throughout the report, when you go check it out, you'll notice pink quotations, and these are the added personal experiences of the council with the subject matter that we write about. Their voice is a really solid reminder that these data points are not abstract. They're not felt abstractly. These high costs are felt in a very immediate sense to people. Parents are having a hard time covering the rapidly increasing costs of childcare. The mental health of people struggling to get by on a daily basis is being compromised. And for people who are trying to work extra hours to help pay bills, jobs are just not wanting to pay overtime, and they're not wanting to provide extra hours for people. So the council recognized their own personal strategies of resiliency throughout this report, but there are other supports that are helping. In our report, we document that childcare subsidies, housing vouchers, which lower the cost of rent, SNAP, tax credits, all of these have an impact on a family's ability to cover their costs. In the section of our report titled Meeting the Standard, Reducing Costs, We document that a medical assistant who's earning $18.79 per hour can meet all of their family's expenses with the help of childcare subsidies, housing, housing voucher, some food subsidy, and healthcare assistance. Without these work supports, the family is only able to cover 59% of their basic needs. So I would just wrap up by really giving a big thank you to the foundation, and particularly including the perspective of the Family Advisory Council throughout this report. Their input was really valued. Yeah.
Yeah, I appreciate that. And yes, I just want to echo that. Thank you to the Family Advisory Council participants for really bringing this, vetting this report, and for you all for incorporating their feedback and their experiences, because that's definitely something that WFSA focuses on, that our research is vetted by lived experience. So thank you. All right. I appreciate this time, Lisa and Annie. This is also exciting. Thank you for your partnership over the past years and just the time you've invested into learning about the state and getting these reports and tableaus together. I'm looking forward to sharing the updates with you, as we really get this report out and see how our partners are using the report, and I just really appreciate your time today. Thanks so much. Okay, now for our big public release. Right after the summit event, you can head over to WFSA's website at womengiving.org to download the updated 2022 Self-Sufficiency Standard Report. With the few minutes we have left, I want to give everyone a sneak peek into WFSA's 2023 research. We are currently working with the University of Arizona Community Research Evaluation and Development, also known as U of A CRED, to update the Promising Careers for Self-Sufficiency report. Last updated in 2018, we know a lot has changed. So what questions are we asking? Have there been shifts in wages and women's employment over the last 4 years? What are the 30 to 40 mid-skill, high-wage fields which are promising options for workers in Arizona that pay a minimum of $52,000 a year? And what are the recommendations on how to support women pursuing these mid-skill, high-earning jobs in non-traditional fields without the need for compounding certifications or education? In a nutshell, we want to know what has changed for women in the workforce over the last 4 years. What careers are women pursuing? Are those careers paying a self-sufficient wage? And what careers are paying a livable wage in this post-pandemic time? If you have found this data helpful, please consider donating to WFSA today to help us continue this all-important research using the donation button on the screen.